Welcome everyone. We are going to start the webinar shortly. Please feel free as you come in and join us to write your name, where you're calling us from, and which kind of type of organization you're coming from in the chat. Great to hear and get a wide range of people joining us today. So please introduce yourself in the chat box. Whilst we are waiting, we also have a poll live on the screen. You should be able to see that. There are 4 questions on the poll, each a multiple choice. So please take time to read through that as you are waiting.
Who is this? Hi.
Hi, Hazel, welcome.
I'm trying to get Mike. I'm just hi there.
Hi, it's coming up.
Welcome, Hazel.
Yes, I will have to. I'm just getting everything ready.
No rush.
Hi. Can you hear me well?
We can hear you very well and see you well as well. Welcome.
Okay, thanks a lot. I will put off my audio for now.
We continue to welcome attendees. Please feel free to introduce yourselves in the chat box. There's a chat box where you can speak to all attendees. Please write your name, where you're calling from today, and the type of organization you're representing. We'll give ourselves a couple of minutes before we get into the content of today.
I did. That's it.
Hi, colleagues, welcome. Okay, as more participants join, please do take a moment to introduce yourself into the chat box. Please write your name, where you're calling us from today, and the type of organization you represent. Additionally, you'll see as we're waiting, there's a live poll active on the Zoom, and it has 4 questions, so please just take a moment to answer those questions as we're waiting. We'll start in 1 minute's time. Okay, I think we can open the webinar as people are coming in. I'm sure we'll get a few more joining us. So welcome to the webinar. If we go back to the first slide, please, Dennis, just to launch it. Yeah, welcome to the webinar today. We have a lot of attendees hopefully going to join us today, and we have a rich panel discussion to open up the session. We are talking today about sustaining coordination beyond cluster deactivation. We know that this is a key time for many clusters and AORs, and we want to hear the views of local and national actors and coordinators as they're going through these processes. So we go to the ground rules. Like any webinar, please be respectful. If you have a question, feel free to write it in the chat. We will be responding to questions in a dedicated Q&A session. And during that session, feel free to raise your hand as well. We will have about an hour and a half for this discussion today, hearing from various countries and contexts and different clusters. Please avoid pinning your video because that pins it for everyone. Please be muted unless we are in the Q&A and you have something to ask. And please just be respectful. We're all here to share and learn today. And as I said, please feel free to use the chat function for questions or any issues that you might have. We have a poll that's active that we'll go through shortly, and the session is being recorded as well. Additionally, we have live interpretation at the moment. So to access the live interpretation, you can go to the bottom of your screen, and there should be a More button, which is 3 dots within a circle. Within there, you can click on interpretation. And today we have interpretation into English, French, Spanish, and Arabic. So please feel free to click the language that most suits you. Next slide, please, Dennis. So very quickly, we're going to start with a quick poll, a bit of an icebreaker to kind of see how localized transition is being done at country level so far. We will then have opening remarks to kind of set the scene, and then we'll go into a panel discussion before hearing some reflections from Libya team, and then following up with a Q&A before we wrap up. So we wanted to briefly talk around what is deactivation, what is transition. And this is important to state because we know many clusters are going through these processes at the moment and discussing these things. For a starting point, it's worth emphasizing that clusters are never meant to be permanent structures. They were always intended to be temporary structures activated by the Interagency Standing Committee to respond to an emergency when the government capacity requires it and they specifically ask for support. So it's really gap filling and supporting during the kind of onset of a crisis and through recovery, with the intention that they eventually transition power and leadership of the response back to local and national actors, which includes ministries, and then they deactivate as a result. Next slide, please. So yeah, just a very quick terminology difference, because I know sometimes we hear deactivation when it's meant transition, and sometimes it's meant transition when we mean deactivation. So deactivation is a formal process, a formal kind of closure of a cluster structure. So that's once it has finished a process. And the transitioning is the steps you take to get to that deactivation. So some examples of clusters in recent years that have formally deactivated are Iraq, Libya, and Honduras. And then some examples of clusters that are starting to talk about transitioning to get to deactivation. One example is the education cluster in Ukraine. They are currently going through their process of transition, but they've not yet formally deactivated. And other countries such as Nigeria and Cameroon are also starting that transition journey. So just the technical difference before we can get into the bulk of the discussion today. Next slide, please, Dennis. So we hopefully have given everyone a few minutes to complete the poll on the screens. So we had 4 questions, and I believe now we can close the poll, Dennis. And hopefully we'll see the results. So the idea here was to really get an understanding on kind of what is happening at the country level in terms of transition, but also how is that being interpreted and being inclusive of local and national actors.
Ben, is it possible to still keep on the poll? Because I see that we still have some less responses. We have more than 80 participants joining, and so far we have around 30 responses. So maybe we can keep the poll until the last session. Yeah, thanks.
Okay, great. That sounds good. Yeah, we can use that reflection period at the end to do so. So please, I encourage you to take a few minutes as we go through the session today to answer that poll, and we can have a discussion on it. So next slide, please, Dennis. So as our opening, we wanted to introduce 𝗟𝗪𝗂, who is the Deputy Director of EMOPS at UNICEF. So I would like to hand over to Hazel to introduce herself and give opening remarks. Thank you very much, Hazel.
Hi, thanks, Ben, and good morning, good afternoon, good evening to our colleagues who are joining us here. As has been said by Ben, I am the Deputy Director based here in Geneva on emergencies of UNICEF. And clearly this is a very important debate and discussion that we are having here. I think we are all feeling the wrath of what has happened to all of us over the past, I would say, 18 months especially. And in particular, what does this mean for us, and especially for us as UNICEF, as having 3 cluster leads and as a cluster lead agency. For me, what is really important is our discussions and how we can collectively sustain humanitarian coordination mechanisms beyond cluster deactivation, an issue that sits at the heart of both the humanitarian effectiveness and clearly our shared localization commitments. As we know, clusters are designed as temporary coordination arrangements activated by the ISC, as we've just heard and been told, when national capacities is overwhelmed or constrained during humanitarian crises. Clearly, the ISC framework outlines the criteria for activation, transition, and eventual deactivation of clusters, emphasizing that deactivation should not represent an end to coordination, but rather a transition towards sustainable, nationally owned leadership and systems. However, I think we can all speak to our respective experiences across multiple operations, shows that transition and deactivation processes in some contexts are not always systematically planned or adequately resourced. Coordination capacity diminishes when clusters phase out, resulting in fragmentation of partnerships, loss of institutional memory, and reduced engagement of national and local actors who remain at the forefront. So really what I would like to stress is that when the activation happens, it should not be the end of coordination, but rather a transition to a more sustainably nationally led. And as I've been mentioned, what happens when we deactivate is that coordination capacity diminishes and results in fragmentation of partnership, and I've mentioned institutional memory, reduced engagement of national and local actors who remains at the forefront of response and recovery. We've all seen it. Last year, we've noticed that in terms of cluster dedicated capacities, we've noticed that about 39% we have dedicated capacities as we continue of clusters and 31% globally of information management. So clearly there is a real problem there. Well, as the humanitarian context become, we all know, increasingly protected, complex, and very much resource constrained, effective cluster transition is no longer a procedural step. It is a strategic investment in resilience, preparedness, and locally led humanitarian action. Clearly, this session, therefore, comes at a very critical moment, bringing together global, regional, and country coordination leadership allows us to move beyond policy discussions towards practical solutions and a shared learning on sustaining coordination functions during and after cluster deactivation. So finally, let me conclude by emphasizing one simple but critical point for us all. Successful cluster deactivation should never result in a coordination vacuum. Instead, I would strongly say it should mark a moment where national and local leadership is stronger, coordination functions are institutionalized, and humanitarian action becomes more sustainable and accountable. If localization is to move from commitment to reality, then how we manage transition and deactivation processes will be one of our most important tests as a system. UNICEF remains committed to working alongside our ISC partners, governments, and local actors to ensure that coordination transitions leave behind a stronger system, not weaker ones, and that the progress achieved through collective humanitarian action is sustained well beyond the life of clusters. Just as a final note from me, we are going through the cluster simplification process through the Humanitarian Working Group here in Geneva, and there will be additional standardizations and guidance coming from the ISC within the next couple of days. I know there's been lots of discussions of different models about how we go about coordination. So I'd really like to strengthen the importance of coordination and not merely view coordination as it having to be exclusively a cluster construct and model. So Ben, thanks a lot. Really appreciate that I can be with you here today and encourage a very good and frank discussions, because given the resource constraint and the geopolitical dynamics, coordination is critical to ensuring that we have an accountable humanitarian response to most affected communities. Thank you.
Thank you so much, Hazel, for that valuable intervention and setting the scene nicely for this discussion today and the dialogue on this. I think one of the points that you really clearly highlighted, that the cluster isn't the be-all and end-all with coordination. There needs to be a continuum of coordination to create that sustainable process that we work in. So thank you so much for that. And I know in your extensive experience that you've worked across the spectrum with grassroots organizations all the way through to, UN headquarters. So I think having that message championed across those different levels is really valuable. So thank you so much for that. We now move on to sharing a resource that we've recently created to support clusters and AORs to make transition processes as localized as possible. So if we could have the slides back up, please, Dennis. Thank you very much. So as we know, transitions are meant to be planned in from the start of cluster activation, but we know in reality, transition plans aren't always made early on in responses. So therefore, we know, especially with Tom Fletcher's words after the humanitarian reset last year, there's a real commitment across the sector to push forward cluster transitions where possible. Therefore, the Intercluster Localization Working Group work together to bring evidence-based ideas, recommendations, and solutions for cluster teams when they are working through the process of planning and implement transition plans. So we have created a resource which we have published online and we will share in the chat, which basically gives step-by-step guide to cluster teams of how at each step of that transition journey, they can both involve local and national actors, but also make sure they are driving conversations, helping inform decisions, and therefore at the end of the transition process, local and national actors are in the driving seat of coordination going forward. So we very much, as you absorb the conversations from today in the next week or two, take time to look through that resource. And if you are in a cluster team at the country level, really digest that and see how that can inform conversations you are having. So I believe now we are going to the panel discussion. And I would like to hand over to my colleague, Caroline, who will be moderating the panel discussion. Thank you very much.
Thank you, Ben. Thanks for the introduction. Dennis, could we have the PowerPoint up? Thank you. I want to say I have the pleasure to moderate a panel discussion of 3 fantastic speakers today. We will start with our colleague, Mr. Hadid Haddad from the Lebanese Ministry of Social Affairs. We'll follow with Mrs. Anastasiia Donska from Tech for Ukraine. And finally, we'll have some information shared also by Dr. Sharon from DEMTOU Humanitaire in Cameroon. So without further ado, I would like to provide a bit more detail about our first speaker, Mr. Hadid Haddad from the Lebanese Ministry of Social Affairs. He is a social protection and cash expert in Lebanon with more than 13 years of experience in social protection and basic assistance, working with the Ministry of Agriculture, leading the social protection platform, and he has previously worked with the UN and INGOs. Thank you very much for joining us today, especially in light of the current situation in Lebanon. So we truly appreciate you stepping in to this really important discussion we're having today. And we'd love to hear from you in terms of the institutionalization of the cluster system and your experience in country with the transition process, particularly from a food security and social protection sector. So over to you, Mr. Hadid, for your intervention. Thank you very much.
Thank you so much, Caroline, for this introduction. And indeed, we have a great experience in Lebanon, specifically in the emergency context, while transitioning from the interagency coordination and the leadership of the UN agencies and international communities into more the government institutions and the national systems. If you want to go through the slides that we already prepared for this presentation, we would like to provide a quick example on the previous experience that we implemented were the multi-purpose cash assistance, the emergency multi-purpose cash assistance, following the onset of the conflict in Lebanon. So in 2025, as you all know, we have the response, the emergency response for the conflict, where the cash assistance landscape for the vulnerable Lebanese households specifically underwent a significant transition following the onset of this conflict and the emergency response to, for sure, the conflict-affected population. So as part of this response, the Ministry of Social Affairs was tasked with collecting and consolidating the data on the conflict-affected individuals. Under the MOSA leadership, the coordination and the delivery of both cash and in-kind assistance began shifting toward a more centralized framework under the leadership of the government. This transition was implemented in collaboration with the relevant sectors, specifically the food security and agriculture sector. And here also a big thanks to the sector coordinator back then, 𝗦𝗽𝗲𝗂𝗂𝗍𝗏, and with the basic assistance sector that involved more than 20 partners, including for sure UN agencies, international NGOs, and national NGOs, who all of them aligned their interventions across the multiple phases throughout 2025. So building on this transition towards stronger national leadership, the response framework was guided by three main principles: coherence, efficiency, and alignment. These principles aim to reduce fragmentation, improve the operational efficiency, and ensure that assistance is delivered in a coordinated and consistent manner across the different partners. The next slide, and building on these principles, coherence, efficiency, and alignments, we built the operational coordination framework that was done to organize the delivery of the assistance under the leadership of the ministry. First, a set of operational memo was developed to guide the response. This memo defined the operational parameters of the assistance. Here again, we're talking about the emergency multipurpose cash assistance, including the duration of the assistance cycle, the standardized transfer value, which was harmonized across the different population cohorts and for all the beneficiaries who will be receiving this assistance, and fully aligned with the food security and agriculture sector transfer value and with the basic assistance framework. Second, a partner's beneficiary allocation mechanism also was established. So more than 20 partners participated in this process by using a shared online registration system, which allowed for geographic caseload division and improved coordination, for sure, to reduce the duplication. Third, a standardized agreement were introduced, so all the participating partners signed a standard data sharing agreement and a unified one with the Ministry of Social Affairs in order to ensure consistency in collaboration and accountability. Finally, a data sharing and reporting mechanism also was put in place. So through a dedicated shared folder managed by the Ministry of Social Affairs, the partners also were able to submit their distribution lists regarding the redemption reports and enabling the oversight on the duplication and assurance across the response. So together, these elements form a closed coordination loop, having a great pilot of emergency response, as well as trying to shift it to the regular programs and not only with the emergency ones, ensuring that the assistance can be more improved and led by government authorities and by long-term and national systems towards planning, targeting, delivery, and reporting, which all of them should be aligned in a one single coordinated framework. So this was the main experience that we did. It was great successful for the international community, for the interagency platform, coordination platform, and for the Ministry of Social Affairs and Government. And as a way forward, we are now, based on the new escalation that is happening now in Lebanon, we are building on the previous experience by relying also on the lessons learned outcomes that we developed after we finalized the first emergency, and we are now trying to improve as much as possible the new planning, the design of the response in order to intervene in a very quick manner. This is it now. We will be continuing the same approach with some light improvements in order to address the conflict-affected people basic needs.
Thank you. Thank you very much, Mr. Hadi, for this very interesting and valuable presentation, sharing your experience, particularly on how you have integrated some of the practices and tools from a humanitarian coordination mechanism within governmental systems, through data systems, through standardizing approaches and centralizing the management of all the different partners that may be intervening in the sector. So thanks. This is really, really interesting. And on that note, I wanted to maybe follow up with our next panelist, who will give us experience from another sector. I know, Mr. Hadid, that you might be called into other urgent meetings considering the situation in Lebanon. So before you leave, I mean, if you're able to stay, obviously we would love to have some chance for some more questions and exchanges. But if you have to leave, thank you very much for your intervention today and your support. And we will relay any further questions that may come from our discussion later on. So thanks. So moving on now to our next panelist, Anastasiia Donska. Anastasiia is the co-chair of the Education and Emergency Thematic Working Groups representing Ukraine, representing national non-governmental organization. She's also the program director for Tech for Ukraine, and she leads the design and implementation of development and humanitarian education program and advances sector advocacy and policy engagement. She also holds a PhD in political science. So thank you very much, Anastasiia, for joining us today. And we very much look forward to hearing from your experience in the context of Ukraine of how the specific role of national NGOs have taken in the coordination structure, but also in the transition process. So over to you, Anastasiia, for your thoughts on this.
Thank you so much, Carolina. Good afternoon, all, and thank you all for this opportunity to share Ukrainian experience in transition and the experience of Teach for Ukraine as a local NGO and a part of Teach for All network, as we became a co-chair of such a big coordination system that we are establishing now in Ukraine. So I would like briefly go through three aspects. How did we do transition in Ukraine in education cluster? What is current humanitarian sector, humanitarian coordination structure and architecture, and what are the challenges, especially for us as Teach for Ukraine and local NGO, to be a co-chair of this system. So first of all, since the beginning of the full-scale in Ukraine education cluster, was always really active. We had more than 100 million of children were displaced, a lot of psychological stress, disruption of schools. So this all what was dealing with the education cluster, and it plays critical role in coordinating humanitarian response and ensuring that education remains a priority for broader emergency contexts. However, we always faced the question, and conflict involves continuous, and we have now full-scale war continuous, but how can we transmit humanitarian coordination within the national governmental system in Ukraine? Because the national education system is quite strong, and it could be more effective to coordinate priorities of the ministry, strategy of the ministry with humanitarian actors. So in March 2025, we launched the transition and education established together with the Ministry of Education and Science, a dedicated transition task team. So within the Ministry of Education, we have education sectoral working group, and a part of this group, like a subgroup, was the idea to establish education in emergency sectoral working group. So we worked on a TOR and tried to not simply institutionalize this structure, but also give opportunity to other local NGO to join. So step by step, we organized education in emergency thematic working group. We had open call for all cluster partners to sign in, and also open call for co-chair on behalf of national NGO Teach for Ukraine applied, and now so we have 37 members. It is 8 international NGO, 8 national NGO, and 20. Next slide, please. Now we see that one of the main idea of architecture of education and emergency coordination is that we have a co-leadership model. So we have a representative of Ministry of Education and Science of Ukraine, a representative of international organization, that is Save the Children, and national non-governmental organization Teach for Ukraine. Also in the structure still remain subclusters, northern, southern, eastern Ukraine, who continue to operate actively, and we receive administrative support from Partnership Coordination Office. The first step that we've been taken together in this model is establishing and developing a framework of education and emergency priorities. So what can it be? How can we align, for example, HNRP strategy of the minister, governmental challenges that were also highlighted? So how can we work in a common context here? Then we also worked on a brief on a kickoff meeting on November 6th, and we launched the first offline meeting devoted specifically to catch-up interventions, and you see this picture here now. And we tried to strengthen monitoring and informational support and information management, also raising joint advocacy statement, because now we have a lot of education disruption because of blackouts and disruption of critical infrastructure in Ukraine. So we need really to appeal common to international community, to donor, and here is really important the expertise that we have, like different actors within one sector. So for us, coordination became not only became as an instrument for decision making and accountability, but not also only information sharing. Next slide, please. And here, what is the role and challenges for national NGO? First of all, when we are implementing our activities, we are directly in the field, so we are working a lot to provide it is as far as close to our beneficiaries as possible. And also it is important that we can gather this experience and bring it to the system decision, to the system actors who work and productively try to manage any crisis that occur. And Teach for Ukraine actually now is the only one NGO who is represented in the sectoral working group. Thanks to contribution of the NIDA, we can allow to do it, but because of lack of funding, it could be challenging for other NGOs also to proceed such a work and continue it effectively. And like being alone as a national NGO in this big sectoral working group, it is also a challenge to be heard and to have this actually voice in decision making. Another aspect that I wanted to emphasize is that we can be flexible as national NGO. Yeah, so we can take decisions fast. We can quickly operate in the fields, but when it goes to some policy decisions, it may take a lot of time to proceed with one decision or with one implementation activity. That is why in emergency contexts, it might be not so flexible and not so adjustable to the needs that really emerge in the context. And of course, maybe this having everyone, but strengthening our accountability through proximity to affected population cause that we need to have a really simple but common monitoring system that is hard to establish on this road. When we have government, we have already established coordination monitoring system within OCHA and cluster system, and we have some our instruments that we produce as local organizations. So localization is really the instrument that allows to go into strong and contextualized education and emergency support, but there should be a lot of institutional investments and structural international expertise involved into this process. So as a conclusion, I would say that experience of Teach for Ukraine shows that it is important to include a local organization to solve some coordination problems, but if it is possible to move to stronger national ownership and in humanitarian coordination, it can give even more effect. So every transition requires trust, partnership, and sustained support from international communities, where we really thank you to you. Thanks.
Thank you very much, Anastasia, for this very comprehensive and enlightening presentation where you shared some of the challenges specific to the context with the number of participants in the coordination structure, but also made some suggestions on ways forward and mentioning, that including national NGOs, national actors from the start of the coordination structure, ensuring that there's trust and accountability between all the different stakeholders is essential. I also really enjoyed hearing about how you went about setting up a governance system with the working group, with the ministry having a call for actors to co-chair the working group and the links with the hubs as well. So I think this is really, really interesting and really important to highlight. And I would love to hear from one of our other panelists today, Dr. Sharon NEGSANG, from Cameroon, who also has, I think, some quite interesting points to share from that context. So Dr. Sharon NEGSANG is a senior public health specialist and a humanitarian practitioner. She is a health manager for DEMTOU Humanitarian. She has over a decade of experience in the health cluster coordination, localization, and emergency health response in conflict-affected settings. Her work focuses on sustaining essential health services and strengthening national leadership during humanitarian response and transition. So, Dr. Sharon, I would love to hear from you about your experience in the specific context of Cameroon, and how the participation of national actors has been an opportunity, but there's also been some barriers into the coordination of the sector. So over to you. Thank you.
Thank you, Caroline. Good afternoon, good evening. Welcome to everyone who is here, and thank you for giving me the opportunity to speak on this very important transition issue that we are going through. He said I am from DEMTOU Humanitarian, and DEMTOU is a humanitarian national organization that works in close collaboration with the WHO office in the health cluster. And we work in both regions of the Northwest and the Far North region, whereby in Cameroon we have a lot of these humanitarian crises. So I'll be presenting to you the role of national NGOs in the context of transition in Cameroon. You know, Cameroon is one of those countries that was selected in 2025 for an accelerated transition program. And we know exactly how we say we are supposed to size down and driven by severe global constraints, and that is why Cameroon was selected. So for the transition elements in Cameroon, we looked at we had divided into the clustered deactivation phase, and then tried to shift to a more national coordination, especially in the Northwest and the Southwest region, looking at the ABC transition system, and to able to increase the leadership for the national and co-chaired by national NGOs. Next slide, Dennis. So the coordination shift in Cameroon has a lot of technical functions temporarily being retained, like in terms of standards and the guidance, and operational coordination moves to the regional humanitarian platforms as well as divisional platforms following our healthcare system. So our core principles are trying to do a lot of localization and subsidiarity, and therefore making sure that there is a lot of efficiency while reducing the partner fatigue, as well as making sure that we have one vote in the leadership selection system, whereby we actually had a pool. We had a pool of all organizations that were given criteria to be selected during the first phase. So during this period, every organization gave in their vote, and every organization was represented. However, in Cameroon, there is some specificity because we looked at thematic integration and divided some of these things into thematic integration. We should note here that one of the new things that came in was the attacks on healthcare surveillance, on healthcare systems. That was a new thing that we had, because we had sexual and reproductive health, we have mental health, and then we have refugee health, all of them which are actually under the Minister of Public Health. Next slide. So we divided this into 3 phases. We had phase 1, phase 2, and phase 3. And we had the company, the coordinating structures, as well as looking at the progress cycle, the leadership, and the various activities that was done. In phase 1, which was in 2025, which were just the introduction of the deactivation phase, we had an official communique that was being sent to the Minister of Public Health and notifying them about what is supposed to be done, and identification of the building needs that we needed at that time, where we were looking at the document of the humanitarian response plan, still under OCHA. And with the validation from the Minister of Public Health, we then move forward to the voting of the humanitarian cluster group, and looking at the humanitarian response plan, as well as the humanitarian response plan, which was still under the leadership of OCHA. And within this period, we actually had an election, not an election or a vote, whereby every national NGO had their own voice in this particular system. Next slide. And during this phase, we had we're looking at possibility of national ownership, strengthening Minister of Public Health leadership, at the same time making sure that within this period we align with the needs of the the Minister of Public Health, as well as to improve sustainability, as well as to make sure that we become more resilient. In terms of strengthening local actors, we actually have issues of greater vulnerability, visibility of national NGOs to be able to make sure that we are also involved in all these transition platforms, as well as participation in decision making, direct donor engagement. Those are the things we are looking at, the opportunities, direct engagement, because by the time that we are deactivating, we are considering that national NGOs will be more represented and become more visible. But however, we have still have issues of capacity development and coordination, and as well as being represented. In other operational efficiency, we realize that Cameroon has some context-specific programming, with the fact that the conflict in the Northwest and in the Far North region are a little bit different. In the context of the conflict in the Northwest region, we have not direct involvement of the government. We actually use specifically, and very importantly, national NGOs, because the conflict is actually politically related. Meanwhile, in the Far North and the Grand North region, we have we involve local actors and intersectoral cooperation. So there is a context-specific situation in Cameroon whereby we actually have to be able to apply these transition processes, considering the context-specific situation that we have between the Northwest and the Southwest region, and again the extreme North region, whereby we have mostly humanitarian-related crises. For the risks, the key risks that we have so far, we still have funding gaps, post-cluster deactivation. Those are the questions that we have. We are looking at a weak coordination and capacity information management systems, because we still have issues with the district health information system too. And then we have risks of symbolic localization without power transition. We also have severe interruption in vulnerability in some regions, like the Northwest region, whereby we still have intermittent interruptions because of the crisis that is still ongoing there. To ask what local actors really need at this time as a local actor, we still need, we like from the plan that we have a multi-year cluster deactivation plan from 2025, 2026, and 2027, whereby we actually have a complete transition to the national organization. But we still need a multi-year and flexible funding within this period, so that we can be able to successfully transit through this program. Or we still look at investment in institutional capacity to continue to build people, national capacity to be able to step in as need be. We need access to pool funds and direct donor engagement to be able to sustain national NGO to involve in this activity. However, we also continually need a technical mentorship. If you look at the transition plan, Dennis, can you go to the general slide with the table? Next, yep, here. Look at in 2022, what we envision, we are looking at integration and preparedness response, and to be able to move from the humanitarian action technical group and to work with now the direct full handover and cluster transition. So with this, we think that those are the opportunities for local NGOs to be able to capitalize on. Thank you.
Thank you very much, Dr. Sharon 𝗟𝗂, for this really interesting presentation, also giving another context and another flavor on some of the challenges and the process you've faced in Cameroon, specifically with the geographical coordination setup, but also presenting some of the risks and challenges. And I also really liked seeing that table with the phased transition approach. I think it's really interesting to see and to hear from you some of the needs required so that we can meaningfully transition the coordination system to local and national actors, including multi-year funding, investment in institutional capacity, to name a few. Before we move on to the next section, I know we've had to restructure a little bit the session today. So we will have another presentation in a minute from our colleague who will present a bit of a deep dive into the deactivation process for Libya. But before we do so, I just want to remind all participants that indeed the chat box is disabled, but there is a Q&A section which you can use to ask questions, to post comments. So please use the Q&A for any comments or questions you may have. And following the next presentation from our panelist Omar on Libya, we will be returning to a Q&A section and taking some of these questions. So I will hand back over to Ben to introduce Dr. Omar for the next part. Thank you very much.
Thank you very much for facilitating that. A wonderful panel discussion, and I think hearing from a range of different contexts on different conversations that are happening in country with transition at different stages in their process. We're very lucky to have someone from the other end of the spectrum where we have already gone through a transition and deactivation process in Libya. And I would now warmly like to introduce our colleague Omar, who is currently head of programs for UNFPA Libya, based in Tunis, a medical doctor by training with a master's in public health from the American University of Beirut. Dr. Omar has spent 2 decades at the forefront of humanitarian action. He has led critical health and protection programs for the United Nations in Libya, Iraq, Syria, and Sudan, specializing specifically in gender-based violence, coordination, and reproductive health. So I warmly welcome Omar to join us, and thank you for your flexibility moving around your presentation. And the floor is over to you.
Thank you so much, Ben, and colleague who preceded me talking about this important issue, which is transition. And for us, especially in GBV, and I think that also goes for each sector and cluster, deactivation is not just ending of the cluster. It's about how we ensure and safeguard GBV coordinations and ensure continuity of service. So that's why this is very important and critical for us. In Libya, the context was back to 2022, where the humanitarian team decided to transition from humanitarian to humanitarian development nexus. And the core objective following this, we kind of advocate at the higher level to ensure that there will be no rush transition during that time. So they agreed to have transition for certain period, Jan to March 2020 to 2023, as Protection Task Force. And this Protection Task Force was tasked to present a roadmap to address protection gaps during handover to UN Sustainable Development Cooperation Framework. Next slide. So that's what the context. However, the transition in Libya was dictated by the overall decrease in the humanitarian needs, and also they want. There is also decrease in the number of the IDPs, and also there is need to transit from the to sector for recovery and development and support. And the focus of the transition was to strengthening this and support the implementation of humanitarian development peace nexus, in addition to addressing residual pocket in the humanitarian. So if you look into the situation of Libya, yes, people are leaning towards the activation of the cluster, but still there is acknowledgement there are residuals of humanitarian needs in Libya. The time frame that given during that time was between first quarter into the 2023 and to be concluded by 2024. Next slide. So that was the situation, that was the purpose. Now I just want to share with you the timeline. So in September 2022, we received the blueprint from the humanitarian country team, informing us that they want to deactivate the cluster by the end of 2022-2023. As protection, we saw that this was not really the situation. We do believe that this transition is very, let's say, this transition is not, it's abrupt. It doesn't ensure that smooth transition after the activations of the cluster and sector. So immediately we had a workshop that led by the protection sector, and then also OSHA was part of that, and we developed some recommendation that we shared with the higher level, which is the RC and the humanitarian country team. With this advocacy, and also included other things that we carried during that time. For example, we did an overall assessment, the perception of the international NGOs and the national NGOs about the whole process of the deactivation of cluster in Libya. So finally, they agreed to give additional period for the transition. So instead of concluding the transition by the end of 2023, by the end of 2022 and the beginning of 2023, they give the protection 3 months or 4 months, 3 months additionally to further ensure that there will be smooth transition towards the activation of the cluster. So the lesson learned here, and that's what we learned from Libya, not all sectors will be equally ready to go for deactivations of the cluster, and especially protection and GBV and child protection, since majority of crises that in the regions recently is either majority of kind of armed conflicts, and unfortunately, in many cases, the government was part of that conflict. So the readiness of the government to take over the leadership on coordinating GBV or coordinating protection at large is really questionable. So the lesson learned from here, not always, you are not always obligated to submit for deactivations whenever it's being proposed, if the situation does not in favor of deactivations of the cluster and sector. Next slide. So to sum up, the story is long, but to sum up, a lot of challenges lie behind the deactivations of the cluster and sector. For example, neutrality and the risk associated with giving the government or national NGO or international NGO is always there. This is not like blanket or someone that this is not like it's the same for every setting and every situation, but it differs from situation to situation. But we need also to look into this. For example, if the government is part of the conflict, is it really good, or is it really advisable to give the leadership on the coordination, especially for the GBV, on the government, for the government? So this is one of the risks that people should look into. Staffing vacuum. Usually deactivation, for example, we lose capacities like GBV specialists, GBV coordinator, and many countries or many areas that they might not have the capable staff to replace those capacities. Also operational and data fragmentation, especially for the GBV, for example, the GBV IMS. GBV IMS usually and the cluster system, because whenever they activate the cluster system, in many situations, the the crisis is beyond the government capacity. So in many cases, the GBV IMS system is built away from the government. If the transition was abrupt, then there will be no way. It will be very difficult to really ensure the continuity of GBV IMS, and that also goes for the other services like case management and referral pathway. Also, technical and austerity gaps. For example, if in some situation they propose that if we can do kind of shadowing, but again alone it doesn't help. Another challenge is the dilution of protection. During the transition, if we were not careful, or even after the deactivation, the GBV and protection in general may be diluted completely, and to be unlikely to be visible if you were not careful. So this is one also of the challenges that we learn, in addition to the loss of humanitarian fund, for example, SAFE and other windows that coordinator or coordinating agency might benefit to ensure the continuity of coordination. Next slide. So lesson learned, I think investing in local organization, and this is also, we heard that from the previous colleagues in their presentation, early engagement of the GBV coordinator, and especially when we are to be part of the development of the framework that we are transitioning to, for example, the UN Sustainable Development Cooperation Framework, or any other framework that we are transitioning for it. Informal coordination, this is also, we found that it's sometimes you don't need to have a formal coordination to do coordination of the GBV and referral of the cases. So whenever the situation permit, it's also for a certain time before you fully transition, people can have informal coordination where they can coordinate the response within their operation. Explicit programming visibility. Also, it's very important for the GBV coordinator to ensure that when we are developing the result framework, that GBV is spelled out under the output or sub-output to ensure the continuity of services, and also to ensure the visibility, and also to ensure the space for coordination. Capacity transitioning. This is also very important to ensure that there is a clear roadmap for transferring technical authority from the international community to the government, or to government and the local organization. And I think a good example has been provided, I think, from a colleague from Ukraine, where we see international organization, national organization, and the government all together taking the lead in the coordination. Next slide. Yes. So also, one of the things that it's very important is layering versus merging. One of the things that we learned in Libya here, that layering is very efficient than merging the whole, for example, protection into other sector, or into other sector, or during the deactivation. So, for example, we lean towards layering. So we kept some layers. For example, we had rapid response mechanism, and the rapid response mechanism, we used to activate it. It has a standard operating procedures on when to activate it and how to activate it and what are the response and the response package. So when we transition, and even after the activations of the sector, we kept this layer of rapid response mechanism. Also, localization, I talked about this earlier, and here putting much more resources, or putting more resources to national organizations, and also adaptive coordination. I think also something that we learned is very important to ensure and sustain coordination beyond cluster deactivation. Last slide. This is just for you if you would like to read more and to learn more about coordination. About transition, and this is specifically on GBV transition. This guideline has been developed by the RIGA, the Regional Gender Advisor, and support also and input from Libya and other countries like Iraq. Also, they were in transition. It's very articulated guidance note on what to do, and also what are the positive, what are the recommendations, what is recommended, what's not recommended, along with the checklist on how to prepare for the transition. I would like to take this opportunity and thank my colleague Anna Stone, the regional advisor for the Arab State region, who really supported and spearhead leading the development of this guidance note, and also provided comment to this presentation. Thank you so much. Over to you, colleague.
Thank you very much. Thank you very much, Omar, for this very interesting presentation on some of the lessons learned, specifically on Libya. Before we move to the Q&A, I think it would be an interesting moment to have a look at the results from the pool. So over to you, Ben, if you want to, I don't know how to project the results or how you want to review the results from the pool. Over.
Thank you very much, Caroline. And again, thank you for the intervention from Libya. It was great to hear, how a country has gone through that deactivation process and the lessons learned from that. So I think I've shared the poll results. Can you just clarify, Caroline, that you can see them?
Yes, we can see them.
Great. So yeah, I'll take only a minute to go through here because I want to leave us enough time to have a valuable Q&A with our great panelists and give the audience a chance to ask any burning questions. So we did this poll to quickly get a sense and an idea of what is actually happening at the country level. So the first question really says, what is the current situation? Do you have a cluster plan for transition plan for your cluster? And if we look at just those who answered yes or no, there's quite an even mix of the two. So half of those who answered yes said, 10 out of 11 out of those who answered said they do have a transition plan, and 10 said they didn't. So that's roughly a 50-50 split on country clusters that are in the call that have an active transition plan. So that's an interesting thing. I think if we take a survey a year ago, it would probably be lower. I think if we take a survey again in a year, it will probably be higher, based on total infections pushing from this out of the humanitarian step. Then if we look at question 2, what is the cluster transition situation or status? And I think this is a bit more promising because if we look at if we sum up answers 2 and 3, it comes to around 75% of clusters or responders in this call have said that in their context, clusters have either started conversations on transition or started to transition themselves as well. So I think that gives an idea that in reality, yes, conversations are starting, but we're even seeing some countries lead on transition as well. Then the third question is really to understand. So we've heard kind of like the perceptions at the country level. Now let's hear about the reality at the country level. So we wanted to understand, whether you're from a local organization or an international organization, and whether you've been a part of transition conversations or you haven't. So this is quite interesting. If you look at the highest percentage, that is the 45% of responders answered, I represented ING and I have been involved in transition conversations. I want to compare that percentage directly to the same answer, but for local actors. Only 15% of responders said that they're from a local organization and they have been involved in transition conversations. I think that gives an idea, both that maybe the audience that we have today, but I think if you look at the difference between local actors who were involved and those who weren't involved. It's quite an even mix. So I think it shows that on an average, international actors tend to be more involved in transition conversations at the country level. So I think that's a challenge for us as clusters to make sure that we are involving local and national actors from the start of these conversations. And then finally, there's a question on perception of how effectively local and national actors are engaged in transition. And quite an even split here where about a third of people say they're meaningfully engaged, and then a similar amount say they're not meaningfully engaged. So I think there's still some work to do, which is why this conversation is very timely and why our guidance really hopefully can help clusters do this better way. I'll hand back over to Caroline. Thank you.
Thank you very much, Ben, for this overview. I think it introduces quite nicely the following set of Q&A we would like to do. So I'd like to invite our panelists to put their cameras back on, because I'd like to invite you to answer some of the questions that may come up in the Q&A, but also if anyone has a question that you want to verbalize, please raise your hand so that we can unmute you to allow you to ask your question. But if you prefer typing, please use the Q&A chat box so I can read out the question. I see a first question coming up from Kirsten Perry to Dr. Omar. I'd be interested in getting in touch with local actors, NGOs, or government involved with transition and sustaining the response in Libya following cluster deactivation to compare notes between our experience and context. Would you be able to put us in contact or share an email? We can absolutely, sorry, I was reading the question out loud. We can absolutely, I think I'll invite Omar to share your contacts in the chat. But maybe you have some reflections on this point, Omar, in terms of, I mean, you presented quite clearly in your presentation some of the challenges of the transition, but also how to sustain coordination in a context where the cluster system has been deactivated. So do you have any addition or thoughts to share there? Over to you.
Yes, thank you so much. First of all, yes, we are happy to collaborate with and share our experience with the colleague who asked about, and I will share my contact on that. But I think one of the things that really we sustained the coordination of the GBV is that the fact that we had a clear output on the UN Sustainable Development Cooperation Framework. That allowed us what? Allowed us under the result group to have a working group, a sub-working group with the child protection to work together collectively to do the coordination. So there is huge pushback from the government on the GBV coordination in Libya. So I will go back to the point that as the GBV coordinator, don't wait, or as someone who are interested on GBV coordination to ensure the GBV coordination, especially when there is pushback from the government, don't wait. Be engaged in the development of the result. You will ensure that some indicators, some outputs, some commitment will be put for the GBV coordination. This is one thing. The other thing, the transition, or thinking about the transition should start even before we start the process. I think transition should start immediately when we activate the cluster. We should start about transition. If for example, in Libya, if we think that way, I think we could have saved a lot of challenge. We could have saved a lot of time to land in an area that we are not ready for transition. Building the capacity of national organization. One of the things that help us is that we have very strong network of and roster of GBV case manager. That part of them are part of the global roster. So that is also one of the things that help us to ease and ensure that services will not be disrupted. Yes, disrupted, but not impacted the way that if we were not prepared and have those local organizations well-trained, advanced, before even we think or thought about transition. Thank you so much. Back to you.
Thank you, Omar. I think this links quite well to the following comments I see in the chat from entry points for the protection coordination in the UN SDCF process. So thanks for adding those specific points there. I think it's very useful. And I mean, being a co-lead agency that is not UN, I would have further questions on, when the Red Cross movement co-leads a cluster, how can we also ensure some of these elements when we're not necessarily part of the UNSDF process? But we have also our own transition and strategy process that can guide this process. I believe, obviously, I think you made a very key point here of making sure that at the activation process to already think about the deactivation process, involving local and national actors from the start of the activation process and the coordination architecture, to make sure that this is built in. This is built in the coordination system. And I'd like to turn to Anastasiia or even Sharon, if you're there, to ask, from your perspective, from an actor that is not a lead or global lead agency, what do you need from the cluster lead agencies to be able to ensure that the transition is done sustainably through a local lens? And Anastasiia, I see your camera on, so maybe over to you if you have some thoughts on what would you need from some of the lead agencies to be able to be present, be a local leading actor from the start of the coordination system all the way through a deactivation and transition process.
Yeah, thank you. It's a really good question, and it was interesting also to notice for me that in Sharon's presentation, she also mentioned the same points that I mentioned from Ukrainian perspective. Yeah, so we see different sectors, different countries, contexts, but the situation is quite similar. So as for Teach for Ukraine, I would say that we really need the strong capacity building support. So it's even like informational support, guiding through all the terms, the monitoring system, the network that is established within the clusters and the cluster itself, because sometimes it is challenging to understand how it works on the global level and not and how it was specified to the country, to Ukrainian context. Another here is, of course, really important. It is the funding, and for national NGO, we always work on the project. Of course, yes, mostly project-based or some types of donation-based, and to devote like a strong time, a lot of time to working within the coordination is difficult. So by like finding donors, finding someone who is ready to support, and then like saying the words to national and saying good words of support to national organization, and trying to connect with possible funding opportunities. It is also here could be a really good support. And like a final, it is participating in such events like this. Experience exchange is really important here on this stage. And some of cluster lead agencies, they can also share experience that they have in other countries, like we did it today. Thank you.
Thank you so much, Anastasiia. I think indeed this is something that you mentioned some key points that have come up quite consistently from the different presentations today around predictable funding, more flexible funding for local actors from the start to be able to invest in not only in the programmatic response but also in coordination capacity, and not only as a coordinator, but also to learn the systems, the data management, and to be able to be a relevant actor in all the different elements that coordination requires, from fundraising to data management to policy and advocacy and resource mobilization. Maybe Sharon, since I see you there, do you have anything to add in relation to how to ensure more equitable transition processes and making sure that local actors are involved from the get-go in coordination systems? Over to you if you have any thoughts on that. I'm not sure. Your video looks frozen, and I can't see you anymore. So maybe I will move on until we have you join again. I see there's a hand up from Dr. Himat. I will ask our webinar host if you're able to unmute that person so that they can share their question.
We have allowed him to talk, and please, Dr. Himat, you can unmute and
okay. Dr. Himat, are you with us? Are you willing to ask your question? Over to you. Okay,
I think the hand might have been up for a while, so maybe it's
okay. Maybe it's
hand.
an old hand. Okay, not to worry. I hear someone unmuted. I'm not sure who that is. Okay, thank you. Thanks for those comments. I'd like to ask maybe a final question to our panelist, and maybe bouncing back on some of the initial points that were mentioned by Hazel, the Deputy Director for EMOPS at UNICEF, on ensuring that transition and deactivation doesn't result in a vacuum. I think this is something that has been very important point that we've discussed and we've learned through this response. And I think Omar also mentioned that even if there aren't any more formal coordination structures, coordination will happen. Actors will talk to each other to make sure that they refer cases, that they ensure that there aren't duplication. So I think coordination happens in any case, in most responses, whether we have a formal or a nationalized or an informal coordination structure. I'd like to hear maybe a bit more from either of our panelists. I will let you decide who is best placed to fit on how to make sure that when we have an informal coordination structure in place, when we have deactivated, what are the basics? What are the essentials that still need to be in place to make sure that there isn't a vacuum, that people who are vulnerable in need of humanitarian assistance their needs are still covered? So I'm not sure who wants to take this first, if Omar or Anastasiia.
Yes, maybe I can say something, and then colleague Anastasiia can come. I think one of the things that's very important to put into our consideration is the leadership buy-in. We say it's informal, but again, you need to talk to the RC, the resident coordinator, because by that time will be the resident coordinator. to ensure that, yes, we will have this coordination. We will call for a meeting from time to time. We will share information. So at least they will be aware of that, and they will be understanding, and then if there is anything that they can provide the necessary support. And not in all transition, the international, for example, organization will be part of the UN Sustainable Development Cooperation Framework. I think this is usually the UN entity themselves. So you need to find a link between the international organization, local organization, on how to coordinate, especially when the government is not taking the lead on the government, in the coordination, or when there is some pushback towards the engagement of the organization. So to sum up, the most important thing is the buy-in of the senior leadership, or at least the acknowledgement, even if they are informed about that we were going to have this type of informal coordination, we will call for meetings. Thank you. Over to you.
Thank you, Omar. I think this is really relevant. The buy-in of the leadership, whoever is leading the coordination structure. Anastasia, any thoughts on this you wish to add from your perspective, your context?
Yes, thank you. I truly support Omar's opinion here on the leadership, and also would like to add that actually I do not believe that coordination will happen in any case, especially like in Ukrainian context. It is seen that it's possible to operate as any humanitarian actor without coordination. So you can proceed doing what you are doing and do not coordinate. What is the results of it? Yes, well, people receive the support, and maybe this support sometimes is based on the needs or sometimes not, but people do receive it, but then we do not have a systematic approach. We do not understand what's happening in the country, and appears chaos. And I truly believe that coordination should be led. Yes, and here is that is why a really strong support needed from cluster lead agency, from international community, to take a look on what's going on in the country, any country, what we are speaking now. Yes, is it really coordination proceed like not only a facade or some type of show, but it is true coordination where we have partner mapping, needs assessment, where we have flexible adjustments of activities to beneficiaries' needs. So in this case, we really see the importance of the common approach to cluster transition and deactivation to ensure that coordination really consists working. So it's closed. Short remark here. Thank you.
Yeah, absolutely. I think what you mentioned is also something that's come up a lot in discussions around the humanitarian reset, specifically when looking at mainstreaming coordination, making sure that coordination is not just a show, it's not just a set of processes and tools, but it's actually meaningful. It's meaningfully aligning actors on a common vision, on a common strategy, limiting duplication, ensuring that needs are covered by all the different actors present in the response. So, really thoughtful, and thank you so much for those really practical reflection, everyone. I wanted to thank all the panelists today and provide a couple of words to conclude this discussion today. I really want to thank everyone who has joined the discussion, who've presented from your different perspective. I think we started the session by recognizing that the transition and the cluster deactivation is becoming more and more common, and we're becoming aware that the activation process is not something that doesn't have an end date. Coordination systems and structures evolve as the humanitarian landscape evolves. And it's important to consider the deactivation and transition process from the beginning. The process is not just a technical step in the coordination architecture. It should also reflect the humanitarian system in the context, but also at large. It's important to link this transition and deactivation process to questions around localization, around leadership, and the sustainability as well of our systems in place. I think we've heard from Hazel as well on the importance of not leaving a vacuum when there is a transition process and a deactivation of a coordination system, and that there is a meaningful process allowing coordination to continue, maybe in another form or structure. I think there are a couple of key messages that came out from the discussion today, which I would like to highlight or summarize in a couple of words. That transition needs to be planned. It should be deliberate. It should be reactive. We should plan for it from the start. And we saw from Sharon's presentation as well that the process is planned for. We know what the different steps are, and this really allows us to be accountable to the process. It allows us to engage the stakeholders that need to be engaged from the early stages of the dialogue, and it sets a clear roadmap to be able to ensure that we are collectively moving towards a humanitarian system, a response where government and local actors are leading and are at the center of the coordination and the response. The second point I wanted to highlight is, and I think this came up also very clearly from Anastasiia and Sharon, but also from one of our first speaker, Mr. Hadi, that we need to engage local actors meaningfully. They're not just a checkbox at some point in the process. They really need to guide the process of the transition and inform what coordination structure is relevant and adapted to the context, depending on the structure of the governmental structure or the presence of the crisis or of the actors in the context. Those local and national actors really need to lead in shaping what the coordination will look like beyond the cluster system. And the third point I wanted to highlight is that institutionalization takes more than good intentions. We need to make sure that if we want to sustain coordination structures after the deactivation of the cluster system as we know it, there needs to be adequate financing, there needs to be political commitment, and there needs to be investment at the national level, within local institutions, to ensure that this coordination is really grounded in the local architecture. So just the final words as we're meeting the hour, I would like to really emphasize that we should shift towards stronger and locally led mechanism from the start of the setup of the activation of the coordination system. And we've heard through the discussion today that transition can pose some risk if the systems are not in place, but it's really also an opportunity. It's an opportunity to hand over the leadership to those who should be leading the response, which are local and national actors. So on that note, I'd like to really sincerely thank all our panelists today, from Ukraine to Lebanon, Cameroon, and also sharing the experiences from Libya, really grounding this discussion in operational reality. So on that note, I would like to close this discussion today. Thank everyone for participating, and we will look forward to sharing some of the key resources and the recording of this session in future communication. Thank you very much, everyone, and have a good end of the day.
أو خش ماسير ودي بيشوا من ده كلام